Good morning, and thank you very much for joining us. I am Iori Folari, and Asukwa James is here with me as well. Asukwa is the TVC news editor. Well, we have a number of them, but he's one of them. So here we go. Well, good news in the sense that, and here I'm referring to the partial easing of the lockdown restrictions, COVID-19 lockdown restrictions. Now, when I say good news, because yes, a lot of people can get at it, but it's also worrying because cases are reported to be going up. I don't know if Nigeria is included, but definitely around the world. In the US, they're having a rethink. Maybe we're a bit too hasty. Maybe we need to pull back a bit. In the UK, they have the same worry, the same concern. I don't know. We need to open up, but it's a bit worrying that we're also hearing, alongside these stories, the fact that the cases are rising. Okay, what we'll do first, the easing of the restrictions as they concern us. We have a report. Even if you know about it already, it doesn't hurt to give you an overview of where we are.
Another phase of the lockdown. Another review of the restrictions. This time it seems the economy is gradually opening up, but with a lot of caution. The spikes seen in this phase of the lockdown have been alarming, and evidence of the strength of the raging pandemic. Now President Muhammadu Buhari has considered recommendations from the task force and approved an extension of the lockdown, but also with certain modifications.
Mr. President has carefully considered the fifth interim report of the PTF and has accordingly approved that the phase 2 of the eased lockdown be extended with another 4 weeks with effect from Tuesday, June 30th, 2020 through midnight of Monday, 27th July, 2020. Permission of movement across state borders only outside curfew hours with effect from 1st July 2020.
Movement across state boundaries will be allowed, but only outside curfew hours. All daycares and primary schools to remain closed till further evaluation. Schools are encouraged to continue with e-learning and visual teaching, but pupils may proceed to take the National Common Entrance as soon as is feasible. For churches and mosques, no specific change. Phase 2 remains.
Now that the spread has entered the community phase, which only states and local governments should drive, the federal government says it will deploy resources to states on the level of compliance and the extent of collaboration received on this public health emergency. Under the ongoing restrictions, the federal government will pay close attention to certain sectors, including international travel, entertainment activities, education sector, and public and private offices. Femi Akonde, TVC News, Abuja.
Well, indeed, our thanks to Femi Akonde. Azukwo, you see that we're being, well, as Boss said there, the president had carefully considered, recommendations to him and had, allowed that. We're being careful with our language. Of course, the lockdown thing, we don't want to get rid of lockdown, so we're talking about eased lockdown.
So they have to add the lockdown.
Yes, you have to add the lockdown too. So eased lockdown. Okay, maybe we'll be talking with our regular, friends, our contributors. We have a couple of experts with us, that are already well known to us. There's Dr. Boya and there's Dr. Mibawambu. But how have you seen our behavior as it relates to COVID-19 being in existence in our communities? I ask this because you see people have actually begun to behave as if COVID-19 is behind us. Over the weekend, I saw in some environments, some local, houses, what I mean by that is face me, I face you type of scenarios. They had chairs out in the front and we're actually carrying on with a birthday party. Now we're going to go to that because there's a limit, there's a specified number all these. What have been your experiences as to how seriously people are taking masking, social distancing, and then coming together in numbers?
Just like you said, people have COVID-19 to so many people is over, so they need to go back to their lives. Face mask, apart from people who are selling, because those they have to also wear. Very few people are wearing face masks, and the gatherings, you still see people gathering around, talking without the face mask, because the face mask is supposed to protect you and protect another person. It's not that it is
There's
like
a certain etiquette involved, as a matter of fact.
it is not that it's a vaccine, no, but it is something that we need to do so that we don't spread the virus. And if you look at it across, if you go to markets, the women hardly, there was a day I went to, I was driving past the Akpongwa market. All the women there, they were just shouting. In fact, they didn't even wear the face mask. Some didn't wear, some just put it. Face mask has now turned to chain mask.
Yeah.
So they were shouting and
because
calling customers and all.
Some places you won't be granted access if you don't have a
Yes,
face mask.
and
So because of that, people put it on their chin.
Yes. The only set of people that I know have, make sure that if before you go into their facility is all at the supermarkets. They have the wash hand basin there.
Right.
You wash your hands.
The malls.
The malls. And then you wear your face mask.
Which incidentally, those who would be very, very careful are even advising themselves privately,
Yes.
stay away from the malls.
Exactly.
I mean, it's not official, advice, but they're saying if, you just might want to impose that on yourself. Because one can't be too careful. Medication, of course, we don't know anything about what the medication, that's still a long way off. The vaccine is a long way off. But I do hear, at least, I can't say that is quite universal or pan-Nigeria, but I do hear that people are resorting to all sorts of local,
exactly
devices.
Yes, people are using dongoyaro, drinking dongoyaro, trying to
they're
make
now
sure that
preparing all sorts of agbo concoctions.
Exactly.
With all sorts of things in there. There's turmeric in there. There's lemongrass in there.
Yeah, there's
and
ginger.
then you steam, and then you cover yourself. With something, and just breathing all those vapors and all those hot things. Well, we have two doctors with us. Good morning, doctors. Dr. Mebawadu and Dr. Boyo.
Good morning.
Thank you very much. Thank you very much for joining us. Okay, we have the two of you there. Okay, Dr. Mebawadu, let me start off with you. As you were hearing me say, people have, out of desperation, resorted to local medication. That is to say, especially the vapor inhaling aspect. They think it really does great things to them. When you mix up all sorts of dogoyaro and turmeric and ginger and all those things, and then drink some of it, and then do, I don't know what you doctors call it, but you put a cloth over your head and you breathe in all those fumes. People are swearing by it. Somebody was even on social media saying, I had a cough and I just went this way and I don't have any problem anymore. Your comments, Dr. Mebawadu.
Well, when you are confronted with an unknown, as like COVID-19, when a situation is such that, there are no clear-cut protocols on what you should use, people tend to experiment with a lot of things. And we've seen that experimentation, not just at the level of even science, even in America, when they had hydroxychloroquine and later sanitizer and all those kind of things. It has now dovetailed into our own system where people were clamoring for a local solution to COVID-19. Now, let us get it clear. Let me just talk about steam inhalation. Now, let us understand very well that there's a texture and there's a maximum temperature that the linings of the respiratory system can function, okay? Now, the respiratory system is a very delicate system. The lining is a very delicate system. The cells are there. They have their own optimal temperature which they can function. If you do repeated steam inhalation and you put all sorts of gamuts into it, you are going to further cause injury to the respiratory system. Let's get it straight. Don't doubt about that. The body system is very exact the temperature at which molecules will be absorbed, you know, how the protein will function there. So if you continuously do steam inhalation, because we have not gotten any anecdotal evidence as far as steam inhalation is concerned, we're not so sure how many days you need to inhale those, how many times you need to inhale those steam in a day. So why would anybody now mix all sorts of junks together to inhale its respiratory system?
Okay.
What of those people that are allergic? Okay, what of those people that are allergic and they are reacting to some of these contents? What will you do to them? So please, and please,
one has to be extremely cautious.
It's not a treatment. It's not a treatment for COVID-19.
Dr. Boyo, your thoughts, sir?
Yes, and thank you for inviting me. The first thing is that our citizens have lost confidence in the in orthodox medicine because they are hearing that it cannot be cured. They are not hearing that it can be managed, and we can manage the symptoms. And only 2% of COVID-19 positive persons with symptoms die. They've not heard the other aspect of it, that the remaining 98% are being managed successfully in the country. For instance, of the 10,310 cases in Lagos, only 127 have died. Now, that is huge, and there's no number that is small enough to accommodate. But to remember that so many people have been discharged. So the first problem we have is not COVID-19, is that from inception, we as orthodox medical practitioners have not won the confidence of the people. 1, 2, we are so expensive that the average Nigerian cannot afford private and even government hospitals. 3, the idea that they hear mistakenly that this thing cannot be treated. You know, most languages say "àìsàn gbóògùn." They treat the disease that does not listen to drugs. So they have been left to their own various machinations. So that's what has led to us being where we are now. But beyond that, availability of healthcare at the grassroots is minimal. Where the primary care even exists, there will be no doctor, or they are poorly run. And when you go there, the time spent in hospitals can be very scary. Then 4, very, very important, this 4th one, there's a mutual suspicion between hospitals and patients. Patients think that coronavirus can be contacted by visiting hospitals. And then the hospitals are also scared of patients. We have had calls from my own private practice to refer people to government hospitals, and they were turned back. We don't treat this just because you just have a temperature. Some government hospitals will be suspicious of you and turn you back. Many private hospitals, they have taken the principle of to err on the side of caution. So they see you and they find out you have a temperature or you are dyspneic, you have respiratory challenges, they send you to a government hospital. Now, this is not all the private hospitals. So there's this thing, in the first 1 or 2 months of the crisis, most private hospitals are virtually empty. Many people did not step in yet, so there was mutual suspicion. The private hospitals were suspecting people were coming corona. People are suspecting that the hospitals even have corona. But it has eased out now. People are going to hospitals. But you know, our general thinking in Nigeria from the days from many years ago is that when the average Nigerian is sick, the hospital is not where he goes to. The first thing is to self-medicate. And he asks for somebody. Every compound has a local uncertified doctor. Then after that, he asks his mother will tell him to take this or that. Then we'll try some native medications before we go to the hospital. So it's what Lucas and others call the tip of the iceberg. So from the
in addition, Dr. To what you say, Dr. Boyo, and swinging to Dr. Mebawadu, the traditional herb markets that exist in just about every market in the Southwest, I wouldn't be surprised if it wasn't like that all around the country as well. They are consulted. People go to them. They have all the concoctions, all the leaves, all the roots, everything in there. You know, and you go home and boil, and people consult with them as if they were health practitioners as well, and say, look, what do you think I should be doing for this and that one? He said, of course, with the confidence of a professional, That's no problem. You're lucky you came to me. And, we'll, put together some roots, some leaves and all of that. And people are doing that. I take your caution that people need to be very, very careful about what they are putting on themselves. But as Dr. Boye is concerned, has been saying, people don't want to just lean back and not do anything. In the light of science saying that, the truth be told, we don't have medication for it yet.
Yes, as much as science does not have medication for this yet, okay? It doesn't really say that there's no solution in terms of transmission, in terms of prevention, in terms of first response. Now, what we have failed to do is this. Government has chosen to personalize this COVID care. They personalized, they held on to it, and they felt that they know everything about it. Now, look at where the situation we find ourselves. We've not been able to mobilize a simple community development association to act locally, to act even at the ward level and know that, listen, these are the trajectories driving the numbers in this locality. How do we respond to it? Government has to stay either in Abuja or in Ikeja and dish out information that people don't believe. Okay, now, you cannot separate the culture of the people from their healthcare system. We have not seen a way to integrate the cultural belief to healthcare system in such a way that the culture can flow seamlessly with health behavior and changes. We've lost that. Now, here we are, okay? The numbers are rising, okay? There is the science and the science of COVID-19. There is politics of COVID-19, and there's a business of COVID-19. So there's so much interaction in this triage that we don't know which one is true, which one is okay. But again, great as it may, we have now moved to a stage of stigmatization, okay? And stigmatization leads to people drawing away from the health system, drawing away from government information, and then seeking alternative care. Because now every little thing that happens to everybody now, they believe is COVID-19. I think, yes, as much as we need to communicate COVID-19, we've communicated it wrongly. What we are now seeing is a massive misinformation that is going on. Yeah, it's not too late. It's not too late to reverse this thing.
Okay.
Because now we have to really go back to the community level, at the level of CDA. We must be able to do what I would call community vulnerability in this vulnerable. What are the tractions in the community that can drive these things?
Okay, one moment, please.
Action team.
Okay, one moment, Doctor. I wanted to bring in, Azuko and I were talking about this before we came on air. We wanted to know what the challenge is, how much of a challenge it is, what you medical people are referring to as asymptomatic cases. That is, people that actually have the virus, but do not show any infections and are still able to transmit the virus. How much of a challenge is that to our understanding of what to do? Because if a person isn't showing any symptoms, might a person not then be something of a time bomb? For instance, if a husband is asymptomatic but no symptoms, so he doesn't feel ill, is he not in danger of infecting his family in due course?
Yes, it's possible. That's why the first thing is testing, then tracing before management. Testing is key. If you look at it, so far in the country, we've only tested 132,304. It's on the testings that we found that we can find out those who are positive and those who are negative. But after testing, we can now tell people to do self-isolate if they have no symptoms.
Sorry to interrupt you, Doctor. What you're saying would have to. I'm very sorry, Doctor. What you are saying would have to include testing those that apparently have nothing wrong with them. I think that's the nature of
exactly.
Exactly.
Yes, no, that's why last week I went for tests, and nothing's wrong with me. I just went for tests as an exposed personnel. Okay. Since I work in the hospital, I see a lot of cases every day. I may have come across asymptomatic persons. My test, thank God, was negative. Now, there are many people who are going around like that, because the testing capability is limited, they have several hundreds of specimens collected that are yet to be tested. So many people in town are going about, and they may be asymptomatic carriers, meaning that they have the disease, they are yet to show symptoms, or they don't even have symptoms. Because it takes 14 days, 5 to 14 days to show the symptoms. Some may not show because of their level of immunity. Now, the dangers with these people is that they are now the people that are doing what we call the active community transmission. These people and those who have symptoms and do not know, then those who have symptoms know and have run away. If you listen to the Commissioner of Health yesterday, he said they're looking for 250 persons who have tested positive. These people have gone underground, and they are unable to even track down those that will meet them because of the way Nigeria. They get a compound, they say they're looking for Musa, and they look outside, they see an ambulance, coronavirus ambulance, say, Musa not there, not there. Go to the next. So you find that, and then they say,
it's not a laughing matter at all.
They don't pick your calls. When they call them, they don't pick your call because before you get tested, they give your email address, you give your home address, and you give your phone number. So most of them, when they see the phone number, and unfortunately for us, they are still using the COVID-19 number to call these people. When people see coronavirus, they go now take off.
I'm not answering.
And if you call them and say, I call from COVID-19,
I will never answer a call from coronavirus.
Yes. So that's it. So whatever it is, even they use ordinary number, our people are scared. And as I said earlier on, why are they scared? They know that they've been told there's no treatment. Whereas we've found we've not sold the idea, we're not gotten communities to take ownership. Like what people don't even believe these things in the country. I meet them, they say coronavirus has left Nigeria. That is only 419 coronavirus in Nigeria. They hear on CNN and other world media outlets, they see actual people in your hospital. They said no time as a Nigerian TV, including yours, showed us the inside the treatment center and made us to understand that now you can do this without showing the faces of people. So there's not been that dramatic show of people dying in Nigeria. So they believe that it's not happening. So going back to what you asked me about, when you are positive like that and you're asymptomatic, you are the most dangerous because people don't run away from you. You mix with society. That's why social distancing, wearing of masks, hand washing, and self-isolation if you are positive, that's why you are the keys. That's why if you are like that, there are 3 people you are now going to affect, the vulnerables. One,
sorry, Doctor. It's just well that we set all this scene because we now want to relate it to the fact that we are easing the lockdown and, you know.
So Doctor, both of you anyway, is it not surprising that when the infections in Nigeria or the cases in Nigeria is going up, we are easing, and outside Nigeria, like maybe in the US, some states are even saying because the infections are going up, they are thinking about locking down. You know, are we making a wrong move? Are we making a wrong move in trying to ease the lockdown?
Well, look, we made a wrong move long time ago. We made a wrong move when we had a whole month to respond appropriately when we have not had the disease. We made a wrong move when we had just 3 cases, you know, 1 index case and 3 cases, you know, and then we're still allowing entrance into the country. We made a wrong move when we failed to communicate appropriately and allow misinformation, disinformation, and weaponization or politicization of COVID information to spread in the country. We've been making a wrong move. And then even when we're trying to distribute the palliatives, we're making wrong moves. Now, the wrong move has become too wrong now. Now, we've gotten to a point now where people don't even deeply believe that you are responding appropriately to COVID-19. They don't believe it. Now, even when we chose to lock down at the thick of the fear of the epidemic, people were breaching the lockdown and, you know, recklessly. You can travel from here to Zamfara, to anywhere, and to Nigeria, back to anywhere as you like. You can even fly, you understand, despite the fact that there's lockdown on ground. So now, if you have that situation on ground, you know, and then you are saying you are imposing lockdown, you know that this one will just corrupt some people on the roads. The security people will just take money and say, I better go your way, Joe. Even the simple information we say that, okay, don't worry, make sure that your bus is just 60% filled up. Now that one is not happening again. They carry load and overload, as the case may be. So now in this situation, because you must assess your situation appropriately. In this situation, okay, when the cases are
Hello, doctor.
I think something happened. Okay, maybe Dr. Bloyo would like to pick it up
Yeah, from there.
From there, because the theme that Mebaondu was discussing was opening up in the middle of so-called seeming rising cases. And also I'd like to throw in, Doctor, this whole matter of false positives and false negatives being received in these tests.
Let me just, it's back on screen. Welcome back, my colleague. Yes, the most one has said there is this issue of breaching everything. Your question was, is it reasonable that the lockdown it's embarrassing? It is disgraceful. The easing the lockdown right now, if you listen to the statement yesterday, is that you can do interstate travel between, not outside the coffee hours, and the coffee hour 10 p.m. to 4 a.m. The question is, does corona travel at night? Is it that COVID-19 is a nocturnal virus? No. When you allow people to travel from 4 a.m. in the morning, that's when the coffee is over, till 10 p.m. at night, it's not the timing. If you're going to ease the lockdown, you must ensure that buses are inspected, social distancing enforced, mask enforced, washing of hands before entering the buses enforced. If you remember, some months ago, a minister in the cabinet of Boris Johnson was said to have traveled out of London to see his family. It became an outcry, over a minister.
Yes. And
the whole country reacted against it. So right now, my colleague said, the lockdown was never enforced in the first place. I've had doctors, I've had nurses who have gone to their villages and come back and told me that they traveled to Ebonyi, traveled to Port Harcourt, it was only that they were paying more money and they were using Sienna buses, unpainted buses, and they were charging them more so as to send to security men from there all the way there. And they said the security men made 44 billion during this lockdown, quote and unquote. So right now, it was not enforced. So the government may have just decided to say, well, let's say we're even locking down. People are still traveling. Let's don't deceive ourselves. Let's allow them to travel. But if you want to do that, let's remember what I said before. Can we enforce restrictions? Like they said on television yesterday, that airlines that are having 100 seats may have to carry 50 seats. And that will involve placing the extra burden of the charges on the customers. Well, if we're going to have that in the planes, we can have that in the vehicles. Okay. A 14-seater bus should sit 5, maybe 3 or 2 on each row. A 4-row, 2 that's 3 rows, that's 6 people, and 1 in front, maybe, and that's 7. Now, if you look at it that way, a 14-seater bus carrying someone will mean doubling the price of each person. And people are ready to do that. Mm-hmm. So is the government ready to enforce social distancing in the parks, enforce mask wearing? Like somebody said, we have chin wearing now.
Okay. Before we go back to them, we also wanted to bring up the matter of Lagos State, for instance, has approved the establishment of, I think, 7 more testing facilities, all in the battle against COVID-19. It's all about when you identify them, then you can begin to address them.
As the fight against COVID-19 intensifies, various state governments are putting measures in place to flatten the curve. Lagos, the epicenter of the virus, has been at the forefront of this battle. It has always been said that the state is at a level of community spread of the virus. This mindset has led the government to partner with private laboratories in a bid to ramp up testing capacity. Initially, 4 laboratories have been carrying out tests on patients for COVID-19. They include the Lagos State Biobank, Nigeria Institute of Medical Research, Central Public Health Laboratory in Yaba, and Lagos State University Teaching Hospital. The work has been huge for these laboratories, and that's why the private sector is needed.
To expand our testing capacity, we've identified potential opportunities for us to work with private sector, and we've identified laboratories that can do the sophisticated level of testing that's required for COVID-19. This graph shows you that we are now have reached a stage where we've diagnosed over 10,000 cases.
What is going to happen to public testing is still going to remain the same. Even with the offloading of those that want to know their status of the public laboratory, now we are able to test more. There is going to be reactivation and expansion of the working centers, and so that samples can be taken at the local government level. That then we've identified hotspots within the community where also samples can be taken in as much as those coming in fit the case definition.
These private laboratories have been licensed to test patients for COVID-19. While the public health laboratories are free, but the private labs will charge a fee for their services.
It costs between 40 and 50,000 depending on the market forces of reagents to test for COVID-19, one single test. The public health response testing remains free. It is borne by the government. If you want to be tested, if you're a company or an individual and you want to be tested, then you will pay for the test. And that test will be directed to one of these private laboratories that have just joined the consortium. That is the idea.
The state government believes that the inclusion of these private laboratories will help tackle this pandemic. Theophilus Ilama, TVC News, Lagos.
Okay, welcome back, and thank you, doctors, for staying with us.
Okay, so doctor, any of the doctors, so if
you got to speak to one.
Yes, okay, Dr. Tui.
Okay.
Now, what does it take for? Okay, what does it take for one to? For instance, if I want to be tested, I don't have COVID-19, and I want to be tested. So, what does it take for me to be tested? Am I going to call them and tell them I want to be tested, or I just walk in them? Now that we are even hearing that they have so many samples, and those samples have not even gone through the process of being tested.
I will not be innovative in the process of deploying the test, because again, ideally, everybody that requests testing should have testing done. But as it is now, if it's going to cost as much as 40, 50,000, I'm sure Lagos must have spent close to $1 billion, because the last time I checked was about 800 million in trying to do this test. Now, you now wake up, because the gold standard of the test is what we call a PCR. Okay, that's the gold standard, okay? Now, even in other countries, they are developing what they call a rapid test. They are developing rapid tests.
But Lagos is saying that Lagos is also faulting that.
I know. Okay, wait. Now you license some laboratories to do of a disease that is ravaging communities. And if you look at the pattern in Lagos State, those areas, those really well congested areas, those are the places we are seeing the rapid escalation of these things. How would those people afford 40,000 or 50,000? What is the minimum wage in Nigeria? That is still number one. That is actually, the first thing. After testing, you need treatment or isolation, as that case may be. How do you think that it was going to work? Okay? The people that need the test most are being gradually sidelined. You see, the challenge of access or availability and affordability is seriously constrained in this situation. The universal health care does not allow this kind of discriminatory health availability.
Okay, Doctor. Thank you, Doctor. Dr. Mebaudu, one moment, sir. Thank you very much where you've taken it to. I wanted to bring Dr. Boyo in too. Well, you just heard the Commissioner for Health in Lagos State tell us the parameters, between 40 and 50,000, as the case may be. And I wanted to relate this to the asymptomatic carriers of this virus, and the point you made that it's the responsible thing to do, even if you're not feeling you're not feeling bad in any way. You use yourself as an example. Because of your exposure, you went and did a test. Now this is a challenge right here, because I don't know whether we wouldn't be overwhelming the system if people said, look, even that hurdle of 40, 50,000, I'm going to cross that, I'm going to go. Too many people might show up to not overwhelm the system. What do you think?
Yeah, the first thing, again, like my colleague said, it's embarrassing to hear the government saying with glee that we have licensed 7 laboratories. It's very, very shameful. If you want to license people to help you, you subsidize it. Even if 40 to 50,000 naira, you can't get it. It's just like sending somebody to buy salt and praying that rain will fall. If you want them to help us get out of this thing, then straight away give them some subvention, bring down the test, import the things yourselves. I'm sure they've certified these laboratories, found out that they were capable of doing it, but the cost is coming from the reagents. Government is slow because government does not have the reagents. Bring in enough reagents and then tell these people, like HIV tests. HIV tests, thank God for Bill and Melinda Gates Foundation, is virtually free. 1,000 naira will get you a test, some get it free. Bring down these tests to level that can be affordable, and let's have more people do it.
Did you just say in the case of HIV tests, because of the Bill and Melinda Gates Foundation, they become highly affordable?
Yes.
Okay.
Yes. Almost free. It's done in many centers for free, and then in some centers maybe 1,000 naira. Now, what I'm saying is that we know the place. There's 18 local governments in this country. Lagos Island, Etiosa, Mushi, and I think they call Alimosho. If those areas are the areas of the high prevalence rate, then put in more laboratories there and bring down the cost, because this COVID-19 it doesn't respect gender and doesn't respect socioeconomic class. In fact, it is easier for the poor to contact and die because where they stay is crowded and they will likely not go to hospital immediately. So availability and affordability is just out of the way.
Let me touch on, Doctor, let me touch on 2 other, because we have, I'm so sorry, limited number of time. Look, schools, for instance, they've also sort of, in a strategic way said that, look, graduating pupils can indeed return to school. And I don't know what the religious houses are going to be thinking of all of this.
Then how many, what is the number of teachers, that we have, available teachers?
My initial thoughts, you can come in here. That one, I was trying to say the asymptomatic people, if these tests are available everywhere, then the asymptomatic people can get tested. When you don't have the capacity to test, you begin to say if you have had contact with people who have had the disease or you have symptoms and you come. For us to get to asymptomatic, we must have reagents available, affordable, and accessible. Then talking about these schools that were said to be open, they said primary 6 and SS3, people that are going to do exam. That in itself is also laughable. Why? Before you say things like this, you have to ask ourselves, how many of these schools can afford to have infrared thermometers? They go for 30,000 now. If they are cheap, 25,000. Then how many can be tested? How many can be tested with temperature? How many of these schools have running taps that the students can wash their hands? How many of the students can afford the face mask every day, changing the face mask? Then 3, how many people can be in a class? The average class in a public school in Lagos is about 60. And you have a room of 60 people and you want to do social distancing, and even if only primary 6 comes, then you have to say the primary 6 pupils should divide themselves into some of those classes, primary 5 and primary 4, so there can be less in the class. Then not talk of the teacher's strength.
Okay, Doctor, yet again, I've got to go on a break. When I come back, I'm going to want to know, so what is the alternative? Because you doctors are critical, both of you doctors are critical of some of these arrangements. Should we continue to be locked down? Okay, welcome back. We're looking at something of a review of the strategic easing of the lockdown in Nigeria. But we have this report, in the midst of all of this, where WHO is saying that, cases are actually on the rise globally.
As the fight against COVID-19 intensifies, various state governments are putting measures in place to flatten the curve. Lagos, the epicenter of the virus, has been at the forefront of this battle. It has always been said that the state is at the level of community spread of the virus. This mindset has led the government to partner with private laboratories in a bid to ramp up testing capacity. Initially, 4 laboratories have been carrying out tests on
Yeah, you're sorry about that. You've just seen that report. That was, somehow the wrong button was pressed. As soon as they can sort that out, we'll bring that story to you. As I was saying, as a matter of fact, I hear that we don't even have the soundbite. But
Okay.
you know,
So Dr. Tuyi, we are also asking about the you are easing off, you are letting restricting or lifting up interstate travel ban, and schools opening. That is only school, the graduating students are going to school, but the churches, the mosques, open bars remain closed. I'm still trying to look at the sense that is behind this idea.
yeah. But even sorry, Asukwo, in the U.S., I was reading that one state, I can't remember exactly which state now, has said that it regrets opening up the bars and the restaurants. But Dr. Tuyi, Dr. Mebanwadu, please carry on.
Now, you see, let's be clear. The government is not using science in order to drive their decision. That's where we are now. Now, frankly speaking, even if you want to impose lockdown, because it seems the government is helpless. They've told you, go and take care of yourself. The Commissioner for Health just told us that more than 2,000 people cannot be traced. They don't even have capacity to manage isolation. They say go and isolate at home. The testing capacity is really, really, limited. So obviously, if you aggregate all this together, you find out that where we are now is such that government is at loss. They don't know what to do, and they're not having maybe they now probably have sufficient fund to further fight this thing. Now, at this point, if I were to be in government, I would sit down and say, listen, let's look at a community action, or community action team for COVID. Through science, I will stratify each community. Let's say in Lagos, if I'm having so much numbers in Agege local government or Kozani local government, I'll look at those areas. I'll look at factors driving those diseases in those communities. I will craft what I call community vulnerability index. This community, why are they vulnerable? I will look at those things. Based on that, I will set community action team to look at what they need to do. One, do you have a portal for hand washing in this community? Do we have a means of distributing sanitizer and face masks to them? Do we have community action team that can monitor and look at behavior in that community that will further, help us to flatten this curve in that community? So we have to act at local level if we want to see difference in this. Now,
but doctor, keeping in mind also the fact that we can't allow the economy to be injured up to the extent of it being a lost case. So there's this quote-unquote devil's alternative, really, in the situation we find ourselves.
No, you see, that's exactly what I'm saying. If you are opening up the economy in that regard, and so you are easing the lockdown in that regard, you must be able to act at the local level and look at that transmission at the very local level, involving CDAs, even at the level of your word and understanding what is going on and, making the thing to that. So as you are easing the economy, because again, in Nigeria, I'm talking about Nigeria, in Nigeria, increasing lockdown or further locking the place down will not work. We have gone past that stage.
Okay, Dr. Boyo, would you agree with that? Because thank you very much, Dr. Mebanwadu, but Dr. Boyo, governments around the world, not just in Nigeria, know that the economy, they can't afford for the economy to be mortally wounded, as it were. And so when some medical people say government doesn't have any idea, the government has very, very few options. It can't just, as it were, fold its hands on its laps and say, oh, woe is us. Mm-hmm.
Yes, I agree with you. But the problem is that medical people are not saying government is doing nothing or government is useless. Even there are medical people, more senior medical people in government, more experienced medical people in government. So we're not laughing or mocking government. We're simply saying that what we see on the ground is not good enough. Take, for instance, easing the lockdown in the midst of this pandemic. You could have done that. There's nothing wrong in easing the lockdown because the government has to choose between the chicken and the egg. Very difficult. If you keep people at home, how will they eat? You allow them to move, how will you cope? So that is clear. What we are saying is that we have had 3 months, the whole of March, April, and May. If we knew we were going to ease the lockdown in July, by May and April, we ought to be creating water systems in schools. We ought to be fencing public schools. We ought to be investing in public school security. We ought to be investing in face masks for public schools. We ought to be investing in if whatever it takes, we must get water in schools. Not to construct a pipe from nowhere. We can get water in schools by digging a small borehole or by sending water tankers and filling up overhead tanks with tap water for people to wash their hands. And then when you put these things, it's like building a house, you need a foundation. The same thing to do with the motor parks. You want to ease travel, then make sure that all motor parks have washing places. They all have thermometers, and they're going to keep less people in each bus. That we have half or 1/4 of the buses that can.
Okay, so what you're bemoaning the fact that you don't see such planning. Such planning is not evident. Seems to be the point you are making. I get you, sir.
It's not evident. Before easing the lockdown, people have been traveling in. Even if you go out of town now, look at the marketplace. That's why the question of why are the churches locked down that your Asoko asked. Why are the churches locked down? It sounds very, very unreasonable to many people that marketplaces where you go to our markets, they are heavily crowded, no face mask. At the beginning of this program, we mentioned that the marketplaces, people just go to market. Even most supermarkets now, people just move anyhow. Buses, and look at it. Unlike in Europe and America, where schools are, you must go to a school close to your house, public school close to your house. In Nigeria, most of these children take buses, they go on bikes. They go across local government barriers sometimes to attend schools. So our children are going to primary 6 and SS3 are going to go to school in public transport that is not controlled. So right now, the public transport system, you still have overcrowding. People are standing up in the buses and they're still there like that. And this is the type of buses our children will enter. Those that go to public schools, their parents don't take them there most times. They trek, they enter buses. Sometimes they have to change buses and bikes 3 times to get to their schools.
Okay, let's see if we could get in 1 or 2 calls. Obinna in Surulere, good morning.
Good morning.
Go right ahead quickly, please.
I am speaking on behalf of the news I just heard that the lockdown will be eased again.
Obinna, quickly. We are running out of time.
Okay, please. Easing the lockdown for the second time is never the best option for federal government to take in situations like this. Because previously, on the last lockdown that was eased, it was really difficult for Nigerians. And more especially, we here in Lagos, it's very devastating for us because then we had issues like, I think the whole world heard about it, or the whole Nigeria heard about it. The issues of 1 million boys, people barging into people's house in the daytime, and, because of the hunger was high.
Okay, thank you very much, Obinna. Thank you. Obinna is making the point of the social disorder that was among the issues that pressured government to opening up our society again. Yeah, so that's the point Obinna was making, that we have to be careful about this. So it's like, I was talking about being between the devil and the deep blue sea. We have to, open up society. We can't stay cooped up forever, but quite frankly, it's difficult how to know how to go. Palliatives, I don't know the extent to which that worked. The officials that were in charge say that, oh, no, we got everywhere.
Because the thing is about the palliative, so many people thought it was going to be a monthly affair. After that, it ended. So I think that is where the agitation for just open up, let me just go.
Let me go and sort out myself. Good morning, Mr. George.
Good morning, Uncle Yori.
Thank you for calling in. Good morning.
Uncle Yori, the problem I've always said is about implementation of the rules. When, about 2 weeks ago, somebody came to my house from Port Harcourt. I asked him, how did you do it? He said, you just have to have sufficient money to pay on the road. That's the way it's been. The law enforcement agency see it as an opportunity to get rich. is the implementation that counts.
Okay.
And then I heard that you need about 40 to 50,000 naira to conduct a test.
Yes.
All the countries that I know of that are battling this pandemic, it is the government that funds testing. So if the government is not funding testing, how do they expect to eradicate it or reduce it? Enforcement is key. Then funding is another. If we want to do something, let us do it. If we don't want to do it, then we leave it.
Yes. Okay.
You cannot blame people for going for acute treatment when they cannot afford 50,000 for ordinary tests.
All right then. Thank you very much, Mr. George. Very brief. Thank you for keeping it brief. Dr. Mebawadu, just in closing now, coming back to you before I go to Dr. Boyo. Yeah, you just heard Mr. George's comment on what the people will go for Agbo, they will go to Elewe or Mos, they will go to whatever you want to call it for traditional methods. And just in about 30 seconds. Just in about 30 seconds, please.
Again, honestly, government, this is my honest advice. Government should be able to open up and seek input into the strategies they're using now.
Okay.
The input must be such that it will be pervasive, it will go through every strata of the society, it will be affordable, available, and accessible.
All right, Dr. Boyo, your closing thoughts, please.
My closing thought is that government should give to the goose what it gives to the gander. If you tell banks and hospitals to have tap water outside and to do social distancing, when the schools resume, when the motor parks resume, tap and water should be available. You forced us to build taps outside our premises. Now get them into the schools. Let water be available. And it's time for the first time, children will get to school and they'll see water in their school premises.
Thank you very much, Dr. Boyo, Dr. Madili Boyo, as well as Dr. Tuyi, member of Odun, and indeed to the contributors that called in from home. We're going to have to leave it here now. We sort of did a quick review of the measure by government to open up with restrictions and sort of got a professional critique on maybe how we should conduct ourselves in it, because that's what we have. And I think the bottom line that everybody seems to be saying is that people need to take personal responsibility.
Exactly. Exactly.
We're going to leave it there. That's our program today. Please join us tomorrow for a fresh edition. Azuko and I say, keep safe.